Alrighty, so this is my IV return demonstration video. So before I go and place my IV, I am going to ensure that I have the correct order. I'm going to gather my supplies and I am going to explain my procedure to the patient, as well as identifying that this is the correct patient, as well as washing my hands and putting on my gloves. So I will have a blue pad under this. I just couldn't tape this down properly, so there's a blue pad under this. So I'll open that and arrange my supplies. So I have my IV start kit, I have my catheter, and I have my extension set. So before I go ahead and palpate the vein, or put the tourniquet on, I'm going to open up my extension kit. I would also have a saline flush that I would place onto this part of the extension tubing. I will flush this and then place it off to the side for after the IV has been placed. So next I am going to apply my tourniquets. Oh, before that, I'm going to label my IV Tegaderm. So after that, I am going to apply my tourniquet. So with the proper technique, alrighty, boom, I'm going to place it up here. And that is going to be about 4 inches above the site I want to place my IV in. So I'm going to find my vein. So I'm going to poke, poke, poke. Here's the vein I want to use. And then I'm going to release the tourniquet. So next I'm going to take my chlorhexidine and I'm going to prep the site I'm going to go in at. So I'm going to let that dry for 30 seconds and then I'm going to reapply my tourniquet, making sure that the ends are faced away from the site. So next I'm going to open my catheter and I am going to remove the cap. As such. So I'm going to avoid touching the area that I have prepped. So I am going to align, or with my non-dominant hand, which is my right, I'm going to stabilize the vein. And then I am going to enter the skin by holding the catheter with my thumb and my forefinger, and then I'm going to place my pointer finger onto the top of my catheter. So I'm going to still avoid touching the site that I've cleaned, and at a 10 to 15 degree angle, I'm going to insert the needle into the vein, and I'm going to watch for that flash of blood. So we're going to insert this. And I'm going to release the needle. All right, so the needle has been correctly triggered. So I'm gonna place that in the sharps bin. And then I am going to release the tourniquet and occlude the vein distal to the site. And using aseptic technique, I am going, oh shoot, well, I will occlude the vein first and then remove the needle. And continuing to occlude this, I am going to attach my extension tubing of the pre-primed kit to my IV, which is the wrong side. Oopsies. So I will prime it through that end and then connect it through this one. So using aseptic technique, I am going to stabilize this and twist that on so we can connect to this. So then I am going to lock the extension kit. And come on. And then I'm going to place a sterile transparent dressing over the site. And then I'm going to loop the tubing over, and I'm going to tape. And I'm going to make sure that I can see the date, time, and initials so that I can ensure that people know that when this was placed and why it was placed.